So I was really triggered in therapy a couple of days ago. For any of you who've been watching me for a while, you know I'm seeing a newer therapist. Her name is Winnie, and I like her. She is very engaged, asks a lot of questions. I happen to be talking about some of the time I had with Sabine, which was a therapist I saw for about a year, that I spoke of being very attached to, and I got really triggered with my gender dysphoria. I've been having it more so lately. It's been, I wouldn't say, I don't know that I should say severe. It's been stronger. And it's interesting, that's with 57 days now of semen retention, and it's been pretty strong, feminine feelings and such. But in that session, what triggered me as I was talking about back in April or May, I was telling Sabine that by my 50th birthday, I really felt like I wanted to do hormones. I mean, I didn't say absolutely yes, but I was pretty sure. I was probably like 90-something%, 95 or more, I would say at that time, because at the clinic I go to, it's mainly for like low income or no income. Like my therapy's free, and I get a gas card every time I go. If I go to the doctor, it's really cheap, or if I go to the dentist or anything, is really, really cheap. Well, they used to provide hormones. They have trans patients there. And when the Trump administration came in, that changed. Basically, after I told Sabine I wanted to do that, it wasn't too long later that we found out. She had to tell me, and she was sad because she had to tell other patients too. I don't know how many, but if you wasn't already on hormones, then you wouldn't be able to get them through there, because they get part of their funding comes from the government, federal. And when the new administration came in, they decided to cut that stuff off. So it could be expensive otherwise. It wouldn't have cost me that much. I don't know what it would have cost me, but it would probably been very little. And I would have been able to do everything right there in the same office where I had my therapy. It would just been pretty simple to do. But they had to stop doing it except for existing patients. So I remember in that session, I cried. And I had forgotten about that. It's something that I was talking about, the gender dysphoria with Winnie, and all of a sudden I just said it was just ripped away. That's how I put it. I didn't even think about it. It's like it was ripped away. And she's repeated it back to me. She said, ripped away. She said, you said it was ripped away. She said, that's powerful. And she had a lot of feeling in her eyes too. She could see I was hurt. I was like, wow, I didn't even think about how I said that. I said, yeah. I said, I guess it still hurts me. But see, that event happened, and Sabine had tried to get me in a group too. I was going to go to a like LGBTQ trans gay type of group at another office where a man would run these groups for like, I want to say there would be 8 weeks. You would go to one of these groups with maybe 8 to 12 people probably. He talked to me, he called me, Sabine set it up, and he called me, he said, yeah, I think you'll be a perfect fit. And he told me, he said, it's getting a little harder for us to do these groups. This was the other thing. He said, we can't call them anything to do with trans or gay or bi or any of that stuff. It has to be, I think he said something like a lifestyle group or something, because again, their federal funding was being threatened if they call it anything to do with trans or gay, or I was like, wow, okay, wow. In the modern age, wow. But in any case, they just had to change it to something neutral to do the group. But I was at the adult store. I couldn't get off for the Fridays that would be needed every Friday to get off, and my car was having a lot of issues at the time, which now I don't have the issues it had. I got a lot of those things fixed, but so the hormones were cut out from being on the table. The group, couldn't go to the group. And then I found out not too long after that, Sabine had to leave, and she was moving. Her and her partner had gotten a job elsewhere, and she had to leave. So these things all happened kind of not back to back exactly, but pretty close together within a few months. And so after she left and after all this had happened, I had a month before I saw Julie, and I just started backing off. I said, maybe I can integrate this stuff. But what I'm noticing is I feel like, wow, I kind of repressed some of this stuff. Didn't realize I was really repressing because of the way the feelings have come back up. And then lately, I did go through a stage for a while where my dysphoria, it was milder, but it's shot back up. And a lot of times semen retention will it'll bring masculine traits up. It's done that with me before. And it still might, but I know I have a lot more energy in me flooding through me at times with 57 days, and my clarity is better. I feel overall better and calmer, but the gender dysphoria has still been heightened, and I've been having more gender envy, which I spoke of in past video, and I put up a short about that where I told Winnie this too. I can watch TV shows, and it don't matter if it's old, new. I can watch movies, old, new, whatever it is, and I often will identify when I'm having heightened dysphoria. I'll identify with the females, and I'll want to look like them, ones I find attractive and pretty and things, or what I'm noticing what they're wearing, or I want to wear things they're wearing, or I was like, oh wow, wouldn't it be nice to look like her? So I've been going through more of that lately too. So there's this part of me that really wants to integrate this, because I feel like I believe in past lives, and I believe I was a woman in a past life that went through SA and had a lot of trauma. And I've explained this some in other videos. I've come to this through deep meditations, and I believe I had past life regression. Not everyone will resonate with me on this, and that's okay. You just take what resonates with you if you're watching my videos. I understand everyone has different beliefs, but this is what I believe through my own personal experiences I have went through. But I believe in the past life trauma carrying over, and can carry over in our cells, our bodies, into another life. And sometimes we can, if we go through some sort of awareness or awakening of sorts, we can, and go through meditations and different metaphysical things, we can have a past life regression or past life regressions and remember this stuff. So I feel like a lot of that trauma comes from then and can be integrated. But anyone that's had gender dysphoria of any kind, if it's been mild to strong, they know what I'm talking about, how it can just overwhelm you. So I'm trying to work with it, but I don't know. I may still try to see if I can get in another group, if those groups are still going on. Hormones, if I did want to do them now, they would be expensive, going through things, other places or providers to do them. So I'm not sure. It's all up in the air still, but I thought I'd get on here and share a little bit. it's kind of a short video on that, and I guess we'll just see what's going to happen. I'm just trying to take it day to day. Talk to you guys later on. Bye.